Welcome to the office.
Hello.
Welcome back.
Thank you for having me back.
You're welcome. So, how are we doing? We've only seen you a few visits.
Yeah.
What'd you come for?
Well, I came for initially lower back pain was my huge complaint, and pain that was shooting down in my right ankle.
Sciatica.
And
Yep.
so those were the two huge that were bothering me.
And what happened?
I came to see you, and the
What
pain
happened?
has decreased tremendously.
30%.
I would say like 80%. Yeah.
It's only been 3 visits?
Huge
4
difference.
visits?
I lost track.
Yeah, 4
4?
visits. 4 visits. Yeah. And you're coming up from Fresno, right? You're driving. Okay.
Yeah.
And you watched some more videos, didn't you? And what's going on now?
So let's see. I do have knee pain.
Okay.
Worse with long hours, prolonged standing, or with jogging, and then also, well, I've been doing a lot of driving, so my wrists have been hurting. More my right side when I'm doing writing as well.
Okay.
Where I feel that pain and some numbness.
Okay. After writing?
Like 30 minutes in, I start feeling it, and I have to like take breaks, and I can feel.
Well, you can just see looking at the mechanics of your hand is off, and I'm going to explain that. So even if you just look at the mechanics of her hand, just me look as she's speaking and looking at it, this is the first thing I see. She deviates down. She's like this. This needs to be like this. Okay? That's the first thing. So it's bad mechanics. You're like this. This hand doesn't do that. So if you look at this hand on this side, it doesn't go down. Bring that hand. Okay? And you can see it deviates. So this is the radial side. There's more radial deviation. We need more ulnar deviation. Radial deviation is this. Radial deviation is this. Okay, so we're deviating this way. Now, we're doing this. What's happening? We're throwing the angle. There's a bone right there called the scaphoid bone. And that scaphoid, then we have all those tendons and muscles that go over, tendons really, right? They go over it. And the ligaments. And then we're like this for a period of time. What happens? It stays in that position. So we want to work the opposite. So we want to work extensors. Extensors. And that is predisposed by shoulder and neck. Does that make sense? Okay. Now, when we're looking at the knees and we're looking at your back, we talked about how your upper body is behind your foundation, so your posture is off. So you don't want to be jogging like this, you need to be jogging like this. So jogging actually isn't indicated for you right now. Walking, hiking, swimming, elliptical with handles, biking. If you want to sprint, you do a 1-minute sprint, 2-minute walk. 1-minute sprint, 2-minute walk.
Okay.
Does that make sense? Okay. So knees will tune up, but it's nothing that I'm going to actually focus on, like we don't need to take, there's no injury there. Correct?
Okay. Right.
So this is mechanics, this is posture, this is habits.
Okay.
Okay?
Yeah.
I mean, I could take x-rays and this, but that's not your case.
Okay.
Okay?
Yeah.
I just want to be clear about that. But we'll check and tune up what we need to.
Okay.
Cool? What else?
Just lastly, it doesn't hurt or bother me, but I noticed that my jaw as well does pop. It's never locked on me, but it's not a smooth opening and closing.
Okay. We'll take a look at it. All right? You ready for more?
Yeah.
Awesome. Starting at the base of the neck, let's see what we got today. 10 points, lower cervical spine, and that's your shoulders and hands. Upper is good. Let's go off for a little bit. So I have a confession to make, guys. You see me squatting now, right? Because part of, mechanically, I was using the stool and hunching over. And we don't actually do that. But I've been doing that for so many years. What's happened over the years? Forces me in that posture. I don't like it. So we want to make sure that the doctor's following good mechanics also, right? Got to practice what we preach. We are getting the bottom left and the base of the neck today. So today, let's see, let's look at the static palpation. Swelling is down. Swelling is still there, but down a lot. Less sharp when I do that, right?
Mm-hmm.
Bend right. Bend left. Bend right. Right there. We're going to work on her left eye and ilium today. Sacrum is doing better, man. We're going to work on that hip today, okay?
Okay.
Now, we did say we have a measured difference of 1, and we have to be mindful of that hip. But I do need to open it up so that sacrum will also work better, okay? Will I be doing a lot on that hip? No, maybe a couple of adjustments. We're going to start here at the base, okay? 6, right? You feel that?
Yeah.
Okay. Let's do C6, left hip, and then I'll tune up the rest. Sound good?
Mm-hmm.
Nice and easy. Yeah, we just want to open up that joint. Good. Open it up. Good. There it is. Hold really tight. Down. Gotcha. Walk it off once, please. I'm going to put your, you don't need your glasses, do you?
No, I don't.
We're going to go right side down over here. Let's do that left hip. Now what I want to do with that hip, I'm going to do it in a way, I just want to open it up. I don't want to try to lift it up. Let's go right side down. So we're working on the IN ilium here. It's more IN than AS, go left side down. So I'm not going to be setting up right side down. Now I'm getting all that, make sure we get the tissue out of the way. Good. Let's roll the patient a little bit there. Good. Right there. Good. Gotcha. Come on up, let's walk it out. A little different, yeah?
Mm-hmm.
Back over here and have a seat, please. Let's recheck the neck. And then I do want to work on that wrist. But wrist and shoulders. But remember, if we don't change those habits, nothing changes. And part of what I like to explain to everybody, see, I wanted to go for that chair. See that habit, guys? I almost went for the chair again. All right. Let's feel. Back slowly. Bueno.
Yeah, no pain.
Bueno.
Mm-hmm.
Bueno.
Feels good, no pain.
Right shoulder. AI shoulder, more A than I. When it's more anterior than inferior, relax there, look straight. Looking at it, when you do that, you're tightening up the muscles. And there's a little bit of external rotation, so we're going to turn it in, just like that. Okay, bueno. On your back, please. Now, let's check the knees. And what I'm doing is I'm just going to do a little tune-up on the knees there. And if I feel, if we want to do it, just a quick assessment, valgus varus stress, opens up more on the inside, femur. Inside, bilateral femur, tune-up. Again, it's not the cause. Cause is the foundation. Raise your left leg. There you go. Cool. AS talus. Medial tilt. AS talus. There you go. Okay, sit up and let's check the jaw. And you're a nurse, right?
Mm-hmm.
So you can give us feedback in what I'm actually doing if you'd like. Slowly open, slowly close, slowly open. Right goes out, then the left. So we have a left EX compensation, right AI. We're going to work on the EX today. And the way we're going to do that, open all the way, close halfway and hold. Open all the way, slowly close, hold there. And I'm applying a lateral to medial pressure. That's it. Open, close. Open again, slowly, slowly. Open again. Open, slowly close, hold there. There. And the interesting part is, that's actually coming from up here. You feel that? Mm-hmm. Open. Is that different when I hold?
Smoother.
That's coming from, if I hold on this side, open, close. If I hold on this side, open, this side. Yes? Yeah. Left ear down. There you go. Look up, open. Voila.
Yeah, it's a lot smoother, different.
It's cool, right?
Yeah.
Different.
Yeah.
So it was different when I was holding the atlas. Mm-hmm. And when I was pushing on the right side, it was okay, but it wasn't better. Mm-hmm. When I was pushing on the left. So what I'm showing you guys is how the upper cervical mechanism affects, and I talked about it in a very recent video. The upper cervical mechanism can affect TMJ, can affect everything up here, including all the glands in the face. And it's doing it here. Look, there's the vagus nerve, and the vagus nerve is there, that green nerve, and then the TMJ is there, which is the pterygoid palatine ganglion that sits right behind it. Okay, so this bone here, let's look at it this way. Right? This is the atlas. So what did I do? I put, your atlas was sitting like this. It was shifted to the, like this. So your atlas was shifted to the left side and back. So you were turned like that. And what was interesting, when you would open up, that side came down first and this side compensated. I set your atlas as an ASLP. We'll see how it holds.
Okay.
Okay? And then you'll tell us next visit what's different.
Okay.
Cool?
Sounds like fun.
Now let's stand up and let's check the wrist. Squeeze. So I was looking up some stuff, you know, and some people talk about how Gonstead, you know, especially in the work, Gonstead is the gold standard in chiropractic care. And I'm going to correct it a little bit. The gold standard in chiropractic care is tailoring a plan and tailoring what you're doing to the patient's very specific needs, right? It's not the cookbook recipe, because even in any technique we can get stuck in a cookbook. Mm-hmm. And so the idea is, I did that based on what you needed today. We'll see if it holds. Okay? Relax the hand, please. So the gold standard in chiropractic care is doing what the patient needs, not what they want always, and not what you need or want in your practice. And I'll probably get a lot of interesting comments from that. That's all right. Because it's about being real with the patient, being real with you guys out there. Let it go. Wee, dirty. Dirty. Squeeze. Squeeze. Different. Yes? No?
It's in pain right now, yeah.
Okay, let's go ahead and do a little machine on it. Did. That was a bad scaphoid. Come over here, please. And you can report back and we'll see what happened with all of this, right? So I didn't find that on the exam. But you mentioned, hey, I was watching a video, you do TMJ. I didn't know you work on TMJ. I mean, realistically, the way I was trying to work on the whole body. How many joints in the body? No one answered that yet. 206 bones, somebody said. and then we have the sesamoids, but there's a lot of different sesamoids. There's two main sesamoids, so they say 208, but then there's even more sesamoids in the bones that we don't talk about. How many joints in the body? That's the question. I'm asking you that for next time.
Okay.
All right? Squeeze. Squeeze. Have a wonderful week.
Thank you. You too.